Welcome back. Are your feet killing you? I've got a couple of guests can maybe help us answer that question. Dr. Amy Barco and Dr. Jamie Carter with Lexington Podiatry.
Hi.
All right. Now, I see a lot of patients, foot pain and heel pain's a biggie. Plantar fasciitis. Dr. Barco, what is it and how do you fix it?
Plantar fasciitis is inflammation of the plantar fascia, which is a band, a thick band on the bottom of your foot. We see it all day long, and patients can get it a multitude of ways, from wearing the wrong shoe gear, from overuse or misuse, like I didn't do any exercise all winter and then the warm weather hit and now I'm a runner. So that can cause plantar fasciitis, along with a lot of other things.
Yeah, now, P.J. Washington, the UK basketball player.
Yeah, he went into a cast. That's some pretty aggressive treatment for plantar fasciitis, but with an elite athlete, that's something that we do.
So somebody comes to you, they've got the diagnosis. Well, maybe before you even get to the diagnosis, what are some of the symptoms that make you think, that's what it is?
Definitely pain on the bottom of the heel. First thing in the morning or after periods of rest. When that band of tissue tightens up and then you step down, it really feels like a rubber band snapping in there. At first it starts out pretty gradual and you can walk it off. The longer it goes, the more chronic it becomes. It's almost debilitating.
Now, do you make the diagnosis clinically by exam, or there's something else you need to do?
We take plain film x-rays just to rule out a stress fracture, which could happen as well and feel very similar. We also use ultrasound technology in our office to make sure there's no tear, which would put you in a cast.
Like Washington. Okay. You got plantar fasciitis. How do you treat it, Dr. Carter?
There are a couple different ways. We try to be as conservative as possible, but we also want to get you back on your feet. Anti-inflammatories, whether it be oral or injectable, is definitely a first-line treatment. You also need immobilization. Orthotics are a great way to control your foot and not only treat the problem, but prevent it from coming back. Then the final component is really based on stretching your Achilles tendon out. Stretching that band of plantar fascia, which is connected to your Achilles, can really help to not only treat it, but prevent it from coming back as well.
As you mentioned orthotics, that's something you do, and is there a difference between a podiatry-made orthotic and going over the counter and buying a heel cushion?
Absolutely. We have way different standards and they're much higher. So a lot of patients come in and they're like, oh, I have orthotics. I'm like, okay, let me see them. So it makes a huge difference for the patient. We use materials that are more rigid, which at first scares a patient because they feel like it's going to hurt them. But once they get that really good support, then they realize that what they were getting over the counter wasn't giving them support, just kind of shock absorption. So
it's about taking pressure off the wrong areas and applying it in the correct way to make them walk with a heel-to-toe gait, so everything from the ground up is in alignment.
Well, you mentioned gait, and one of you mentioned about running. So if you've got plantar fasciitis, do you want to stop running?
We try not to take people away from their activities if at all possible. So I will do certain treatments to a patient and then say, okay, before you run, you've got to stretch really good before and after. You also need to use some icing for anti-inflammatory from the outside. It's hard to take a runner away from running. It's not great for their psyche. So, but sometimes we do have to take people out of their sports temporarily.
Okay. Well, you do heel pain, but you do all kinds of foot pain, and another thing we see that you deal with is nail fungus.
Absolutely, and 'tis the season.
Describe it to me.
You get a very thick, discolored, maybe yellowed nail. It can be brittle, it can turn green or white, and it doesn't look very appealing in sandals.
So you have to paint it, but can you treat it?
We can absolutely treat it, and you really shouldn't paint it away. People just try to cover it up, and that can be really dangerous because sometimes they can get an infection under that nail if the fungus gets out of hand. So we have nail laser, and we also use topical products. There's some other stuff on the market too, and we exhaust all conservative options. But sometimes we remove those nails.
Now you mentioned remove them before you get to that, because are there medicines you can take?
Yeah, there are. Lamisil is one of the big ones that everybody's heard about. The bad thing with Lamisil is that it can actually damage your liver, so you do have to be very careful. There's usually blood work involved. We always do a nail culture or a biopsy. We send it off, let a lab look at it and say, yes, there is a fungus, it's this one, and it will respond to Lamisil before I subject you to a whole year's worth of oral medication.
Now you mentioned a year. If you end up having to go on that medicine, it's a long time you have to be treated for it.
It's a long time.
Yeah, it takes almost a year for a new nail to grow out. So you want to treat it the entire time. That way it doesn't regress.
Okay, one question before you go. I've heard some anecdotal evidence that, and I've told my patients to try some Vicks Vapor Rub. Does it work?
So they've done some studies on Vicks Vapor Rub. It doesn't do anything except soften nails, but for our elderly patients, that's sometimes what they need. Their nails are hard, they can't cut them. If they qualify to have their nails cut by a medical professional, we do that all day long as well. However, some people just want it to be softer for shoe gear. If their shoe gear is really shallow, it can hurt the nail.
All right, well, that's great information. Thanks for coming in.
Thank you for having us.